Guidance for reducing health risks to workers' exposure to human sewage. Workers who may be exposed to human waste or sewage may be at an increased risk of becoming ill from waterborne diseases. To reduce this risk and protect against illness, the following guidance should be followed by workers. Basic hygiene practices for workers. Wash hands with soap and water immediately after handling human waste or sewage. If soap or water are not available, use an alcohol-based hand sanitizer. Avoid touching face, mouth, eyes, nose, or open sores and cuts while handling human waste or sewage. After handling human waste or sewage, wash your hands with soap and water before eating or drinking. After handling human waste or sewage, wash your hands with soap and water before and after using the toilet. Before eating, remove soiled work clothes and eat in designated areas away from human waste or sewage handling activities. Handwashing CDC Guidance. Follow 5 steps to wash your hands the right way. Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Clean hands can stop germs from spreading from one person to another and throughout the entire community. Wet your hands with clean, running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with soap. Lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. Need a timer? Hum the happy birthday song from the beginning to end twice. Rinse your hands under clean running water. Dry your hands using a clean towel or air dry them. Basic hygiene practices for workers. Do not smoke or chew tobacco or gum while handling human waste or sewage. Keep open sores, cuts, and wounds covered with clean, dry bandages. Gently flush the eyes with safe water if human waste or sewage contacts them. Use waterproof gloves to prevent cuts and contact with human waste or sewage. Wear rubber boots at the worksite and during transport of human waste or sewage. Remove rubber boots and work clothes before leaving the worksite. Clean contaminated work clothing daily with 0.05% chlorine solution, 1 part household bleach to 100 parts water. Personal protective equipment. Workers handling waste or sewage should be provided proper PPE, training on how to use it, and hand washing facilities. Workers should wash hands with soap and water immediately after removing PPE. The following PPE is recommended for workers handling human waste or sewage. Goggles to protect the eyes from splashes of human waste or sewage. Protective face mask or splash-proof face shield to protect the nose and mouth from splashes of human waste or sewage. Liquid repellent coveralls to keep human waste or sewage off clothing. Waterproof gloves to prevent exposure to human waste or sewage. Rubber boots to prevent exposure to human waste or sewage. PPE disposal requirements, single use. For example, dust masks, latex gloves, and Tyvek coveralls. These products should be placed in a waste bag and disposed of in accordance with local, state, and federal requirements. Multi-use, for example, glasses and goggles or respirators. These products need to be disinfected with a bleach and water mixture or in accordance with PPE-specific procedures. Training for workers. All workers who handle human sewage should receive training on disease prevention. The training should include information on basic hygiene practices, use and disposal of personal protective equipment, and exposure to sewage. Workers must also be urged to promptly seek medical attention if displaying any signs or symptoms of diarrhea, such as vomiting, stomach cramps, and watery diarrhea. Vaccination recommendations for workers exposed to sewage or human waste should be developed in consultation with local health authorities. Tetanus vaccination should be up to date, with consideration also given to the need for polio, typhoid fever, hepatitis A, and hepatitis B vaccinations.